Good afternoon, good evening, good morning, wherever you are joining us from different parts of the world. A very, very warm welcome to each of you. I'm Dr. Suhaila Chima. I'm the Assistant Dean for the Institute for Population Health here at Weill Cornell Medicine and also an Associate Professor of Clinical Population Health Sciences. So again, a very, very warm welcome to all of you. So just to review the objectives of the series, we discuss contemporary and critical topics relevant to healthcare, medicine, and population health, examine evidence-based practices which are germane to public health and patient care, and describe opportunities and challenges in the evolving face of healthcare and population health. Housekeeping, your cameras and microphones have been turned off. Please use the Q&A feature to type your questions or comments. You can also type your question or comment in the chat, and we will be able to view it. So if you don't want to put it in the Q&A feature, please go ahead and put your question, comment in the chat feature also. Questions will be addressed at the end of the session, and I will be moderating the session today. Just so you all know, this is an accredited session, both by ACCME and by DHP at the Ministry of Public Health Department of Healthcare Professions Accreditation section. So about evaluations and certificates, the post-activity evaluation will be available in your Cloud CME account by March the 12th. Healthcare practitioners which are licensed in Qatar will only receive their credit once their Qatar ID MOPH license number is provided. You will all receive an email notification once the evaluation is available in your Cloud CME account, and your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So it gives me great honor and pleasure to introduce our speaker for today, Dr. Suhaila Ghuloum. She's a senior consultant psychiatrist at Mental Health Services of Hamad Medical Corporation in the state of Qatar. She's a professor of clinical psychiatry affiliated with Doha Institute for Graduate Studies, Qatar University, and an associate professor at Weill Cornell Medicine in Qatar. She has national and international involvements in mental health and related associations and active teaching roles at various academic institutions. Her past roles include Chair of Mental Health Services in Qatar, where she was instrumental in writing the mental health law, the first mental health strategy, and establishing the Qatar International Mental Health Conference. Her other roles include Chair of the Middle East Division of the Royal College of Psychiatrists, Qatar's representative to the WHO EMRO region, and the GCC Council for Mental Health, executive roles in Arab Board and Arab Federation of Psychiatrists, and zonal representative for the Middle East at World Psychiatric Association. She is involved with the World Health Organization and World Federation for Mental Health on various projects, guidelines, and position statements. Dr. Ghuloum has several research projects, publications, and presentations at regional and international conferences to her name. She is a mentor to various graduate and postgraduate students on their research projects and career guidance. So Dr. Suhaila Ghuloum is going to be talking to us today about holding it together, stress, strength, and recovery. Dr. Ghuloum, a very, very warm welcome to you, and over to you.
Thank you very much, Dr. Suhaila, and the whole team at Cornell for inviting me. Let me just share my slides. So the topic for today is stress, and just so that everybody knows, this was decided as a topic well before all the current unfortunate situation that we're going through, but it seems timely now that this is happening. And I was saying earlier to my colleagues that I was considering whether to adjust the slides a little bit, but then decided I'll leave them the same, but will refer to the situation and when relevant throughout the presentation. So this is my disclosure statement. I have nothing to disclose, no conflict of interest, and these are the learning objectives that I believe you all have. So talking about stress, before that, just little introduction about mental health broadly. What affects our mental health? What makes some people have healthier well-being than others? So there are genetic factors, there are environmental factors, hormonal factors, there are physical health issues. So people with chronic physical conditions are more likely to have comorbid mental health conditions, sometimes secondary to medication, etc. There's a lot of correlation between the two. Loneliness, I've mentioned it mainly because the current world, the changes in society, loneliness is becoming almost an epidemic, actually, both loneliness and insomnia, and therefore I always like to mention them as factors. And then, of course, stress, and stress can be anything from occupational stress, social stress, financial stress, academic, any type of stress. Okay? And obviously, stress of going through conflicts, whether under our control, at our level, or bigger conflicts like the one that we're going through now. And sometimes a little bit of stress is actually useful, because without it, there is nothing that, if you're too calm, for example, as students, let's say, you're not going to study harder. If I have work commitments and I'm too calm about them and too relaxed about them, I'm not going to put an effort to meet deadlines or an effort to make sure my task is at a high standard. So this is it's called the Yerkes-Dodson curve, and it reflects that. So at the at one end of the screen is when their level of stress is very low, performance is also low, and that's where we could feel bored and apathetic. We don't care anymore. And then as the stress goes up, our performance goes up to a certain level, which is what's there as the optimal level. And then beyond that, higher stress will cause now physical, mental health symptoms, which I will be referring to shortly, and our functioning starts to drop. Okay. So to explain the physiology of stress, how it affects us, and what happens to our body when we're going through stress. So I'm aware that the audience are all health related, so I probably don't need to spend a long time on these slides. But in a nutshell, basically, we have activation of the hypothalamic pituitary adrenal axis, the HPA axis, that most, if not all of you would have heard about, and that releases cortisol. And then there's activation of the sympathetic nervous system, which releases both epinephrine and norepinephrine, which are the two transmitters that result in increasing our blood pressure, increasing blood flow to the muscles, increase the heart rate, increase glucose availability. Okay? So this is the hypothalamic pituitary, the HPA axis. Hypothalamus releases corticotropin-releasing hormone, which stimulates the anterior pituitary to release the adrenocortical-tropic hormone, which then stimulates the adrenal cortex to release cortisol. And then there's the negative loop, which says, okay, now I have enough cortisol in my body. Hypothalamus, you don't need to be as active. You can calm down. Okay. This slide is just to show you the interaction of everything, really. So nothing works, obviously, in silo, and it's not only the HPA, it's not only the sympathetic nervous system, it's not only cortisol, it's not only epinephrine. So there are things that make us predisposed to having higher levels of stress. There are individual variations, and then there are the genetics and everything else. And then how our body reacts, like I said, either the HPA or the sympathetic nervous system. And then everything at the bottom side of the bottom half of the slide is all the neurotransmitters, hormones, biological markers that are associated, either increased or sometimes reduced in reaction to stress. Okay. The response that the body has and the response that we have actually as human beings to stress is quite variable. And there are lots of, well, I'm not sure if lots, but there are quite a few theories explaining how we respond to a stressful situation and the individual variations. The one I like, although there's some debate, some discussion around it to what extent it's valid, but this is the one that I tend to adopt when explaining stress. It's called the Sellis General Adaptation Syndrome. And it talks about us going through 3 stages of stress. And it makes sense if we reflect on what we are currently maybe going through. So initially, it's the alarm reaction, where there is the sympathetic stimulation, increase in blood pressure, increase in heart rate, our heightened senses, dilated pupils. So it's the fight-flight reaction. And then the second stage is resistance, when now the immediate threat is gone or has momentarily gone, not necessarily entirely gone. So there's the relaxation that's associated with activating the parasympathetic nervous system, and the heart rate, pulse, everything goes down again. Okay? But we are still on alert because we're anticipating, like in this situation, another attack, another alarm being risen, okay, or arising. And then because of that, because we are on edge, we are on alert and anticipating, that results in irritability, poor concentration, and a sense of frustration, you know, enough with it. Like I've been hearing a lot of people saying, well, enough with it already, okay? And then the last stage is exhaustion, when stress is prolonged, when people are under whatever stress they're going through for a long period of time, they get to a level of exhaustion. And at that level, when all the mental and physical health consequences start to show. Now, I would like to have the audience poll, and we have the World Health Organization has, it's called WHO-5 Wellbeing Index. I have modified it for the benefit of this session. So it's a scale that goes from 0 to 25, depending on the severity. The poll here on my screen, it shows up to question 4. But if you scroll up, you can go to question 5. So I've shortened it. It's usually a 5-point Likert scale. I've shortened it to 3 only. So if the audience can please respond to these questions. These are the same questions that are in the actual questionnaire. It's just the response options are condensed. So I have felt cheerful or in good spirits. I have felt calm and relaxed. And this is, let's say, over the past week. I have felt active and vigorous. I woke up feeling fresh and rested. Or the last one, my daily life has been filled with things that interest me. So the idea of this scale, I mean, obviously, we're not going to make an assessment based on this scale now, because like I said, it's not a 0 to 25, but usually it is, you have 5 options from most of the time to at no time, varying severity, and the total score is 25. Okay, so, and anything less than 50% of that score suggests poor well-being. Anything less than 28% raises the possibility of depression, but it's not a diagnostic scale. It's just to identify how we are. Okay. So question 1, I have felt cheerful and good spirit most of the time, some of the time. That's excellent. That's very good. You have very few people who at no time. I have felt calm and relaxed most of the time, some of the time. That's very impressive. I have felt active and vigorous most of the time, some of the time. Perfect. Few people, 6% at no time. I woke up feeling fresh and rested, 10% at no time. And this could be, I don't know whether it's related to the month of Ramadan. We're not having enough sleep. My daily life has been filled with things that interest me. The majority of people, most of the time, or some of the time, and 4% at no time. Okay, so, I mean, that's excellent. I could finish the presentation now. Everything has good well-being, most people. But for those, the varying percentages of 1 to 4%, those are the ones who may have either poor coping skills or have ongoing stressors that affect their mental health and well-being. And hopefully, carrying on with this presentation can help them identify and get over their feelings. Okay, so how to differentiate stress from anxiety? And that's a question that I hear quite a lot. Fight-flight reaction, which I had mentioned earlier, the being on edge, being alert, high blood pressure, high pulse, palpitations, sweating sometimes, tremor, etc. Okay. However, the difference is that with stress, it's usually time limited. So it's a response to a situation, a stressful situation. And when that stressful situation is gone, the stress is also gone with it. Okay. And like I have explained earlier, it could be beneficial. So a small degree, a little degree of stress can be useful, in fact. And a lot of the time it is useful, okay? While with anxiety disorder, we're now talking about a disorder. So this is a condition, an illness that can be treated, and it's not difficult to treat. And the treatment can be in so many different ways. They don't necessarily require psychiatric or specialist intervention, okay? It's very common. Anxiety disorders, on average, they occur in about 5% of the world population. Some countries much higher, others much lower. But the average point prevalence is 4%, okay? Symptoms include psychological, biological, cognitive, and behavioral, which I will be explaining, okay? So chronic stress which results eventually in anxiety. Chronic stress is when the stress, as the name suggests, is ongoing and it doesn't go away, or there is no, my personal appraisal of the situation is that I'm not seeing a way out of it, okay? So that results in break of the hypothalamic pituitary adrenal axis that I had explained earlier. So the negative feedback from the adrenal to the hypothalamus to tell it to stop firing breaks. And therefore, we have a hypothalamus that's constantly releasing the corticotropin releasing hormones, okay? And therefore, we have now abundance of hormones that result in a constant state of alert, which can result in anxiety and or depression. And a lot of times they're actually mixed, both anxiety and depression. Okay. So within the health sector, the healthcare expenditure is 50 times greater for workers who have high levels of stress. And that's a huge, if you change that to monetary figures, it obviously varies from one place to the other, so I can't name a figure, but that's a huge amount of money spent on stress, okay? Women tend to be more exposed to stress. The presentation in women is a bit different. So women have more of emotional exhaustion, and we are more expressive, it shows more. With men, it tends to be more what is referred to as depersonalization. So the feeling, or sometimes derealization. So the feeling as if they are detached from their surroundings, feeling as if they're kind of functioning on autopilot. I had a colleague from the emergency department who at the time of COVID was extremely stressed, naturally, because of the situation at the time. And he was saying that he goes there, he's functioning, but he doesn't know what it's almost like the routine that literally on autopilot. He knows what he should be doing. He does it, but then he doesn't know how did he get to that point. Okay, that's depersonalization. Okay. Stress independently is associated with significantly higher risk of coronary heart disease, cardiovascular, CVA, diabetes, hypertension, etc. Okay, and obviously it goes proportional. So higher workplaces like larger institutions, larger hospitals, corporations, they tend to have more financial implications, more days lost to stress per worker because of the prevalence of the conditions, to the extent that it's now referred to by WHO and other organizations as a psychosocial hazard. Okay, factors influencing stress. Lots of factors. There are personal factors, there are environmental factors, and others. But thinking of stress from a different perspective, so what makes an individual, two people subjected to the same stress, why do they react differently beyond genetics in terms of personality aspects? Okay, so the familiarity of the situation. Taking, again, the current situation as an example. I was talking to a colleague from Lebanon, and he was telling me, oh, these sounds to us are nothing. We're used to them. Yes. People here, including myself, we're not used to that. So hearing the bombing sounds, they were very scary. They still are, actually, when we hear them. Yeah. Controllability. So what is under my control, what isn't? When something is under my control, it's less stressful because I could think of solutions for it. When something is beyond our control and it just happens to us, imposed on us, that results in much higher, significantly higher stress. Predictability. To what extent am I predicting the current situation? Am I predicting the next bomb that's going to happen, the next loud sound, the next alarm that's going to go off, or it just happens randomly? Personal appraisal of the situation. So my view, my analysis of the situation, my emotional perspective of the situation. And all of these are individual variations from one individual to the other. Okay. So in addition to the internal factors associated with stress, which I will talk about, there are external causes of stress. So major life changes. And interestingly, these are not necessarily always negative life experiences. So, and there's a very old list of life stresses that raise the possibility, the likelihood of having either anxiety or depression. And among the top 5 is actually marriage. So it's usually seen as a positive thing. I have always seen as a positive thing, but it is a major life change that can be extremely stressful. Moving houses, moving countries, all of these. Work-related stress, relationship difficulties, financial problems, being too busy, or sometimes actually being too not busy. So not fulfilling your potential at work, not being given the opportunity to do the things that you want to do. Boredom can also be extremely stressful. Okay. And obviously, children, family, in addition to other responsibilities, can add to the stress. And then there are internal causes of stress. Okay. So the individual's ability to accept uncertainty. So to put an example, work-related situations. Let's say me and a colleague might be under the same stress at work. Okay. We both have we're both working in circumstances when there are lots of changes in the department where we work, for example. Yeah, I am more flexible with these uncertainties. I can go with the flow while my colleague cannot. So he is more or she are more likely to experience stress than I am. Okay? People who by nature tend to be pessimistic, so they always look at, the glass half full or half empty. They always look at the negative side of things. They talk to themselves even negatively. So I may be achieving, let's say I got a very good appraisal. I would say, yeah, but everything gets a 4. Everyone gets a 5. So what? That doesn't mean anything. So even positive things, we see them as negative. Okay. Unrealistic expectations. So I go into something having extremely high expectations, and then these are dashed. And that can result in stress. Being a perfectionist, expecting that everything I do has to be at the best possible standard, that makes me too stressed because I'm spending way too much time and effort into it. And nothing is perfect. And what I may see as or consider as perfect, my boss might not see it as such. Yeah. So that can be very stressful if I had such high expectations. Okay. Lack of assertiveness. So people who don't know how to say no, people who tend to say yes to everything, and then suddenly they realize that they don't have time or they are too burdened. That doesn't have to be in relation to work, even in social circumstances. Generally speaking, people with type A personalities who, to be honest, tend to be most people in the healthcare sector. We are mostly type A personalities. We are driven, we are perfectionists. There are lots of positive aspects to type A personality, but there are also negative aspects. We don't accept criticism. We don't accept a no, although we should be saying it and we should be accepting it. The competitiveness that we tend to have and the feeling that everything we do has to be done now, that is quite stressful. While people who are type B personalities, who are very relaxed, very chill, oh, so what? I'm going to do it. Don't worry, relax, I will do it. Those people, they are actually, even physically, they are in a much better shape because they rarely have heart attacks before age 70, and that's based on research evidence. Okay. Having a support network that helps cope with stress. That's one of the main coping skills, mechanisms, actually. Sense of control, I've already spoken about having control over what's happening or not having that control. Being optimistic, embracing challenge. So when you're in a difficult situation, viewing it as a problem or viewing it as, okay, I'm going through this difficulty now. This is a challenge. I am going to address it and I will take it as a learning opportunity. Okay. Ability to deal with emotions, and that's quite important, having emotional intelligence. So recognizing my own emotions, my own feelings, and parallel to that, recognizing the emotions and feelings of others and how they perceive me, that actually helps resolve a lot of conflicts socially and at work. Okay? Being prepared for the stressful, potential stress, being prepared for any changes, any unexpected circumstances, that helps minimize stress. Okay? Enjoying what we are doing, whether at work, at home, socially, trying to find the sense of fun in whatever we are doing, all of these factors influence our stress tolerance. Okay. So now I want to talk about how all of that affects us. So like I mentioned, stress affects our mental health, psychologically, physically, emotionally, and behaviorally. So psychologically, either irritability or withdrawal, it could be both extremes. It affects our appetite, it affects our sleep, poor sleep. A lot of people, when they're under stress, they think they're the only ones who are suffering with it, and therefore they don't talk to others, and that increases the sense of loneliness and isolation. Okay, and then gradually they become detached from others around them. The cynicism, so we kind of we don't see positive in things. We become very cynical and critical of everything that happens around us, and a very high sense of self-doubt. Even in people who are very confident, they start doubting themselves. Am I doing anything wrong here? That, you know, one of the psychological symptoms that happen in response to stress. And like I said, it could result in anxiety or general unhappiness or sometimes depression. Okay, risk of suicide is always increased when people are under a high degree of stress, especially when it results in depression or anxiety disorders. Cognitive symptoms, memory problems, poor concentration, being forgetful, and you know, the number of times that I had people ask me, do I have dementia because I'm forgetting things? It's not because you have dementia, unlikely. It's more likely to be because you are stressed and you are worrying about too many things, and therefore the brain kind of prioritizes what is important based on your judgment and what is not. So memory becomes less, it becomes weaker. Your registration, recall becomes weaker. Inability to concentrate. Poor judgment, which results in snappy judgments and making errors because of it. Okay? Constantly worrying. So I'm sure you've all had the feeling, I certainly have gone through that, when I have something major to do or to deliver or a deadline, and then I have lots of thoughts in my mind how I want to do it. And then when you go to bed, your mind is just constantly racing that you're unable to sleep because of it. So you're sleeping either too much as an escape, most of the time sleeping less, eating usually less, loss of appetite, sometimes in atypical situations, eating more. Isolation, I've already mentioned that. So rather than engaging with colleagues and friends and try to express how we are feeling, people tend to become more isolated and withdrawn. Procrastinating. So because of the cognitive deficits that happen, we delay doing things and we kind of avoid doing them. Absenteeism, so missing work when it's related to work, or sometimes, or missing social gatherings, for example, and events, or sometimes presenteeism. So you are present, you are attending, but emotionally and cognitively you are absent. So you're there with family, but your mind isn't with them. You're absent-minded. Okay, so that's called presenteeism. Sometimes it does result in substance use, alcohol, smoking, drugs, benzodiazepines, etc., or nervous habits. like nail biting, shaking the legs when it becomes much worse in these situations. Physical symptoms, stress can affect all parts of our body, basically. So headache, muscle aches, abdominal symptoms, diarrhea, constipation, loss of sexual drive, loss of interest. It lowers our immunity, and therefore we become subject to a lot of physical health problems, and all of these health problems can be associated with stress. Every part of our body literally can be affected because of stress, including malignancy, etc. Okay, can we go to the second poll now? And here we will have a few questions about coping mechanisms. So if the audience can please respond to these questions. It's one question, but it has stems, different options, and try to select up to 5 coping mechanisms that you tend to revert to use when you are under stress. Okay, so some of these are healthy, positive coping skills, and some are negative coping skills. Many people tend to have a mixture of both, but some have more of the positive, others have more of the negatives. And those who have more of the negatives tend to be the ones who are more likely to suffer with consequences of stress. So exercise is one of the best coping mechanisms. Comfort eating is one of the worst, in fact, and we have almost 1/3 of the audience using comfort eating. Isolation, again, that's very high here, and that's one of the negative ones. In fact, the advice is to try and socialize, and I'll come to that in a minute. Smoking or alcohol, 5% only. That's good. Hopefully, it's even less than that. Social support, that's excellent. Having a hobby, that's excellent. Spiritual approaches, that is extremely useful, actually, as coping mechanisms. Okay, so moving on. Oops. Okay, so coping strategies. There are lots of different coping strategies. So broadly, I would divide them into appraisal-focused, problem-focused, or emotion-focused. Appraisal-focused, it means trying to rationalize the stressful situation. And it's also what is referred to as positive reframing. So trying to make the best out of a challenging situation. Take a problem and change it into a challenge that I want to learn from, okay? So try to view things in a more positive mindset. That's appraisal-focused coping strategies. Problem-focused tends to be more when the problem is within our control. So let's say something that happens at home that I could find a solution for, something that happens at work that I could find a solution for. So, and that solution is what is referred to as problem-solving skills. So learning how to identify the problem, categorize different possible solutions for it, choose the one that is the top most suitable for you, or the one that you're more capable of implementing, and then implement it and test it out. Does it help solve the problem or not? If not, then you go to option B, and so on. Okay? So that's problem-focused. And then emotion-focused is how we feel about the situation, and that tends to be when, like the current situation, war, things that are situations that are out of our control, and therefore we can't do anything about them. So we either, so it relates to things like acceptance, submission, again, trying to find strength in coping with that stressful situation that is beyond our control. Generally speaking, the better we are at managing our own stress, the more we will affect those around us, and it will show more positively on those around us, and the more we would be able to help them. By the same token, the less the stress of others would affect us. So if I can deal with my stresses, and like now in this situation, if I can deal with the stress I'm feeling because of the uncertainty with this war, then if I can control that, and I can control my emotions, my behavior, my feelings, then if those around me are very stressed, their stress isn't going to affect me as much because I have come to terms with it. okay? While if I didn't, then the stress of everyone around me would make it even more worse for me. And that's why it's important in this situation for people with children, for example, to try and keep things at home as calm as possible so that it doesn't reflect on children and they don't become even more anxious in the current these days, okay? So like with everything else, the best cure is prevention. So how to prevent stress? I cannot stress enough the importance of healthy eating, sleep, and exercise. And I have to admit that when many, many years ago, when I started my career in psychiatry, I used to feel kind of bored in a way, maybe, or superficial, advising people about healthy eating, sleep, and lifestyle, etc., because I thought, oh, that's so cliched. But actually, there's so much research evidence for the importance and how crucial all of these aspects are. And we know more and more how sleep has health, physical and mental health implications. Exercise is as good as antidepressants, as good as benzodiazepines, and managing mild to moderate stress. Healthy eating and what we choose to eat and how it affects our body, and biologically, how it protects us from disease, okay? Taking time off, not only a holiday doesn't always work because then you're going back to the same situation, but managing your time where like now, for example, with the news, you don't have to be constantly watching the news. Nothing is going to change if you miss the news for half an hour. So give yourself breaks throughout the day where you're not touching your phone, you're not watching TV, and you're not discussing with others around you about the situation or political discussions, okay? Delegation skills when it's related to work or other home stresses, for example, allow other people to help you, okay? The ego crusher I have here is that things go on whether with or without us. Okay, work goes on with or without us. Home life goes on with or without us. Let's be realistic. So try to protect yourself and prevent yourself from being stressed. Okay. I just wanted to mention this in relation to evidence for sleep. So it says here, sleep duration of fewer than 6 hours was associated. This is a systematic review, I think it was. It was less than 6 hours associated with higher levels of depersonalization, I've mentioned earlier, burnout, physical, emotional symptoms, memory loss, etc. So considerable physical and mental health implications of poor sleep, okay? Talking to others is the best prevention. One of the best preventions, having a positive mindset, problem-solving skills. I've mentioned spirituality. A lot of you, I think it was 38% of the audience who chose spirituality, either religious practices, yoga, mindfulness, all of these aspects, okay? AI, there's a lot now on AI, actually, on managing. There are lots of apps on how to manage stress, apps that teach you how to do breathing exercises, how to do relaxation exercises, how to distract your mind from the stressful situation. So we could use apps more positively, actually. Okay. So this was a study that targeted people in emergency departments and how they cope with stress. And I just wanted to mention this, that sometimes even little things, I thought that was funny. Let me just remove the, okay. So the bathroom was considered a place for de-stressing by the majority of participants. So the idea, I mean, it sounds odd choosing the bathroom as a de-stressor, but the idea is that people need a space to be on their own, to themselves, yeah? And in a hospital setting, the only place they may have is the bathroom, so they go there. Yeah. And that's fine. If it gives you the space to be alone for a few minutes, that is actually a major de-stressor. Okay. Management. So once you do have stress, how do you manage it? Recognize the warning signs of excessive stress that I have spoken about earlier, the cognitive signs, behavioral, psychological, emotional signs, okay? There are lots of advices and the list goes on. I'm conscious of time, but the list goes on of what to do when you're under stress, okay? Try to find out what works out for you. So there are lots and lots of advices if you search online. I have a long list here. it doesn't work for everybody. It varies from one individual to the other. Like I said earlier, there are individual variations in how stress affects us, but also in how we deal with it and what helps us cope with it. Okay, so try to focus on what you can change. So now we can't change the political situation around us, but we can change how we deal with it. We can change how much time we spend on the news. We can change to what extent we allow it to mess up our day. So having a routine to our day and continuing with our routine before this whole thing happens as much as possible, that helps us have a sense of normality and it helps us cope better, okay? Try to set boundaries and prioritize what you need to do so that you don't end up being stressed by 10 tasks that all now have a very short deadline of meeting them, okay? Be organized in how you do things, but also the table, let's say, or the desk where you're doing your work. I've heard so many times colleagues who say, I function best when the table around me is a mess. I don't believe that at all. You may think so, but try organizing your table and see how much better productive you will be, okay? I've mentioned earlier things like progressive muscle relaxation. That's a technique where you learn how to stretch different muscle groups for a certain time frame, and then you releases them. And the idea is that you're teaching your body how to relax, okay? Relaxation responses, some of these things you need to do them with a therapist, and others you can learn how to do them on your own. Biofeedback is done usually with a therapist. And again, it's for you to, it's basically connection to monitors that show you your pulse, your heart rate, your breathing rate. And then through relaxation, you see how it all drops. And then you learn how to drop your pulse, drop your heart rate, drop your breathing, etc. Okay. Guided imagery, you do that with a therapist where they help you try to shift your thoughts, your images to more positive ones, to imagine, you know, like it's done in hypnosis, for example. Okay. So imagine yourself in a pleasant place, calm place, somewhere that you like, somewhere from your childhood that you liked going to, for instance, etc. Breathing exercises, you're familiar with this concept of take a deep breath, count to 4 through your nose, and then out through the mouth, count to 8. The counts vary from one practice to the other. Medication, mindfulness, cognitive behavioral therapy. This is the most evidence-based for many mental health conditions. Okay. And that's just to show the evidence for mindfulness-based stress reduction. It does help release anxiety, lower levels of anxiety, depression, stress, but it did not have much effect on burnout. Okay. Our role as colleagues, as friends, to listen to those around us, to not minimize their feelings. So nowadays, if you had a family friend who told you, or a family member who told you, I'm scared by these bombings or by the sounds, don't tell them, oh, don't be silly. You know, validate their feelings, allow them to express them, and then try to comfort them. Most of the time, people just want to walk. They want a listening ear. They don't necessarily want you to give them solutions. They probably know that you don't have a solution, or you may not have a solution. Finally, when you need help, talk to family or friends. There are workplace clinics. HMC has the helpline 16,000, and then you choose number 4 to talk to trained therapists who would guide you and provide support, emotional support. The general practitioner, emergency department, and then the private sector, of course. And the numbers of private practices here in Qatar are limited, but they are on the increase, and there are excellent therapists, psychologists, and psychiatrists in the community. And I will leave it with this. Thank you very much.
So thank you, Dr. Ghuloum, for an excellent presentation. If you could just stop share, great. Thank you so much. So we've had some questions, which are coming in. Of course, a very, very timely topic. So thank you again, for doing this session today. I think it'll be really, really helpful. So I'm going to start with the first question, Dr. Ghuloum. A lot of people are afraid with the current ongoing situation. So that is lending to a lot of stress. I know we've gone through the session and you've given a lot of it. What would you suggest that people can do on a day-to-day basis, to try and help them reduce some of the stress that this situation is causing?
I would say the most important thing is to recognize that fear is normal. We all are afraid. When you hear it, it's not normal not to be afraid when you hear such a loud sound.
Right.
But also, okay, what to do when you're afraid? I would say the most important thing is to, at the time, when you're hearing these sounds, be with family as much as you can. Be with close people who are close to you. Talk to someone, even if by phone, talk to a friend. If you're living alone, for example, talk to a friend, talk to someone you trust, talk to a family member, okay?
Right.
Practice safety, obviously, always staying away from windows, outdoor places, etc. Minimize the time that you spend, like I said, watching the news.
Right.
And stop listening and stop even opening messages that come on WhatsApp, because 95% maybe of the time they are false messages, and they don't help. They just make you more worried. You think you want to be always in the know and be aware, but that doesn't help you. Maintain normality to your life as much as possible. So if you used to go to bed at a certain time, continue to go to bed at a certain time. I've had a patient yesterday who was talking to me and saying that since the war started, he sleeps downstairs to be ready. And I was telling him, be ready for what? He said, to leave the house when needed. I said, okay, but your children and your wife are sleeping on the first floor. Would you leave them and go? He said, no, I will go up to them first. So just sleep with them upstairs. So try to maintain normality as much as possible.
Sure.
If you have a hobby and interest, it may sound, this is not the time for a hobby or interest, but this is actually the most time that you should go to your hobbies and interests. Okay? And again, religious approaches, spiritual approaches, do more and more of that. And I have zero doubt that spirituality is a huge, huge source of support.
Sure, absolutely.
And with practice, the level of anxiety will get less. It won't necessarily get less first day, first time, but if you continue to do these things, it will definitely get less, I have no doubt.
Sure. Thank you. So, Dr. Ghuloum, again, some questions coming related to the stress which is being created at homes now, with homeschooling having started. People have to work from home also. And so address this question, please. How can people, try and sort of address the stress which is being created from the situation? I know we'd gone through a similar situation in COVID, but this is somewhat different also. So if you can give some advice on that, and then there's a second related questions regarding children, and I'll come to that.
I would say, I might be addressing a little bit children as well in response to this question.
Sure.
So I would say, again, acknowledging that it's normal to be stressed. Yeah.
Right.
But if you're working from home, wake up at the usual time that you would wake up to get ready to go to work. Get ready to go to work just like you would do if you were actually going to leave the house. Change your clothes. If you put makeup on, put your makeup on. So, again, maintaining normality as much as possible. If you can, assign a place, a table, a corner in the house that this is now your workplace while you are working from home. And the same for children. A desk, this is now their school from home. Yeah.
Right.
They wake up in the morning, they get ready, they wash their face, brush their teeth, they wear their school uniform, and they are ready just as if they are at school. And then they have breaks and they do whatever they did, except they can't play with their peers, obviously, but they can play at home. during that time. So try to maintain as much of a normal situation as possible. And it's important, I might be jumping into the next question, but it's important to recognize that children, if you are feeling stressed, then your children must be feeling equally, if not more stressed. Their ability to understand uncertainty, to cope with it, is much less than ours as adults. And therefore, it affects them much worse. They have less vocabulary to express themselves. They have less psychological mindedness to express themselves. So it may show with them with behavioral disturbance, with shouting, screaming, whatever. If you maintain your calmness, that will reflect on them. They learn by modeling. If they see you anxious, even if you don't say anything, but they could see it in your behavior, they will be anxious as well. While if you pretend to be calm, it will, I mean, it's kind of biofeedback, really. It will reflect on you. This pretense will gradually become your nature, and then it will reflect on the children too.
Absolutely. Yeah, so I think you have answered, because there was a question on how children who are going through stress in this situation. So again, like you're saying, role modeling is very essential. Would there be anything else that they should specifically doing with children to help reduce?
Children, allow them to talk, let them express, before, I mean, I think a lot of people are talking to their kids, I assume. But before you talk to them, let them do the talking. So listen to them first. Let them express themselves. If they said, I'm scared, let's say you have a 12-year-old boy who said, I'm scared. Tell them, this sexist remark of, you're a boy, don't be, don't tell me you're scared. You should be a man. You should be more manly, acknowledge and validate their feelings. Allow them to be scared, but comfort them with how you respond to them, your tone of voice, the content of what you tell them. Explain to them the situation in simple terms that they can understand, so that they know, but not giving them information is harmful, as harmful as giving them too much information. Because now kids hear things, they listen to things anyway. So we should be giving them that information, actually.
Great, thank you. So there's a question about, is there any medication, for stress? The $1 million question. Or what is the right time for a person, but again, the first question is there any medication?
If there was medication for stress, I would immediately open private practice and sell it, because I will make millions out of it. So no, there is no medication for stress. There are medications for anxiety disorder once stress does develop into a disorder. But most people don't have a disorder. Most people have stress. And that can be helped non-medically, and again, I want to stress exercise specifically. Exercise is as good as medication. So whoever is asking for medication, if you just do 20 minutes of cardio type exercise 3-4 times a week, which is very doable, that's as good as having an anxiolytic. Avoid medication. Medication should be only used for disorders, only used when other non-medical interventions have not helped.
Okay. Thank you. So Dr. Ghuloum, just talking about exercise, there's a question about, is there evidence showing that certain types of exercise can actually increase physiological stress? And how do we differentiate between healthy stress, which is adaptation, or harmful stress due to exercise, or different kinds of exercise?
I'm not aware of any evidence that exercise increases stress. Exercise is a de-stressor, actually. Exercise is healthy and helpful. I don't know whether the audience member who's asking the question is referring to unhealthy habits associated with exercise, where, for example, bodybuilders using drugs or non-prescribed or even prescribed hormones, etc., to help build their muscles, that can result in anxiety. As side effects, they can result in anger, agitation, aggression even. So that is unhealthy, but exercise itself is always healthy.
Sure. Good, good. Thank you. Dr. Ghuloum, I know you went through some of the strategies, the coping strategies, to manage stress. But again, now since people are going through it, and maybe the community, will need some time to recover, it's going to be maybe a long-term stress. Can you just reiterate some of the things that they could just do maybe on a daily basis or at home?
Sure.
Or if need be, go to a psychologist or therapist.
Sure. So on a daily basis, I would say, again, as much as possible, keep a normal routine despite the changes. If you're working from home, keep your routine, but instead of going to work from home. And the same for children, the same for older adults, keep a daily routine as much as possible. Minimize, communicate with family, communicate with friends. There's nothing wrong with expressing your fears to others because most likely they are experiencing the same fear. But also don't make all your communication about that. Talk about general things, talk about anything, whatever you used to talk to before. If you used to call your friend and talk about football or talk about, I don't know, paddle or talk about fashion, continue to do that. Yeah. Minimize the time that is spent on your phone, especially for news.
Yes.
Okay? And I would advise strongly, ideally try to have at least an hour off your phone. I know people find that extremely difficult because there is this need that we have to be always in the know, which doesn't make any difference. Ultimately, it's just making us more stressed. So try to give yourself, 3 times a day, half-hour breaks from the phone, from the news, from any discussion about the war.
Right.
And I can guarantee you your anxiety level will be reduced. Do breathing exercises at home. Just watch, you'll find a lot of videos on YouTube about progressive muscle relaxation and breathing exercises, meditation. Do that at home. There are apps that guide you through meditation. Do that. If you're more into religious practices, adhere to prayer times. Pray. What I advise people is to be slow. A lot of us tend to rush into our prayer. We don't even remember what we said and what verses we recited. Do that slowly with concentration and focus. Don't rush into rolling your sajada at the end. Just stay sitting on the sajada for 2 minutes after you're done praying. You don't have to be reading any prayers. You don't have to be doing anything. You don't have to be reading Quran. Just sit for 2 minutes. That teaches you how to calm and how to minimize this urge to be constantly on the go, constantly doing something.
Absolutely. So thank you so much. Go ahead. Yeah, please.
When to seek therapy, I think if all of that has failed, or if you notice that your level of stress is now affecting your sleep, you're unable to sleep, you have lost your appetite, you're unable to function at home or at work, at that level, or you're starting to have physical manifestations, physical symptoms, then talk to someone. You could talk to the general practitioner, to a therapist, either private or call the helpline.
Sure. And thank you for answering that, because that was another question, that when do we seek help? So thank you for pointing that out when you feel that you're unable to function, showing physical symptoms and things like that. So just talk a little bit about sleep, since you mentioned that, okay, just because of stress, you are unable to sleep, and we have questions on that. What can they do to, help reduce the stress, to enable them to sleep? Is there anything, and I know you've referred to meditation, breathing exercise. There is a question about supplements. Is there any evidence for the use of supplements like Valerian root or St. John's wort or anything that you would, evidence-based recommendation that you would recommend?
So in terms of supplements, well, before supplements, so how to help without using anything. So just natural methods of helping yourself sleep. try to, the usual advice that people take lightly, but it does actually work, and that's evidence-based, is to avoid using your phone at least an hour before sleep. I think if I said more than that, nobody would do it. At least an hour before sleep, don't look at your phone, because whether it was positive news or negative, it's going to mess your sleep up. Yeah. Try to have a regular sleep pattern. I know it's difficult in Ramadan, but try to have regular sleep patterns. So whether it was weekend or weekday, as much as possible, a regular sleep time and regular wake up time. So let's say in Ramadan 12 and go to bed at 12 daily. Wake up in the morning, same time daily. Go to bed at 10 daily, so as much as possible. There are things, there is actually evidence that repeating words like mantra, chanting, that kind of thing, it does help minimize the stress level, and it helps reduce cortisol levels. So repeating things. So when the old wives' story of count sheep before you go to sleep, that actually does work. So it's about repetition. So you're either counting, you're for Muslims saying istighfars, for example, before going to, while you are trying to fall asleep, or dhikr while you are trying to sleep. If you have lots of thoughts in your mind, just jot them down, write them down on a paper, put a piece of paper next to your bed, write things down, because writing them, it kind of erases it from your mind, the worry that I might forget the next day, or I need to repeat it so that I don't forget it. If you write it down, khalas, that's it. So all of these help actually improve sleep. The lighting, the degree of temperature, etc., and the bedroom, they all contribute. And then in terms of supplements, so melatonin helps. People take high doses of melatonin and they take it wrongly. In my view, I think melatonin should be taken in time with the melatonin cycle, the natural cycle of releasing melatonin in the body, which is 7 or 8 p.m. So that's the time that it should be taken. And then 2 or 3 hours after that, you will have more. It doesn't work for everybody, but it can help. But even melatonin, all of these supplements, they shouldn't be taken. They're not advised to be taken for long periods of time, but for a short period of time. Magnesium, there's a lot of evidence of the benefits of using magnesium, and sometimes people mix the two. Melatonin, I wouldn't recommend more than 5 milligrams, actually, mostly 1 to 3 milligrams maximum can help sleep. Supplements like St. John's wort, ginkgo, these are actually evidence-based to help reduce stress and reduce anxiety. But we need to be cautious. The fact that they're herbal doesn't mean that they are safe. So if you are on medication, just make sure that you discuss that with the pharmacist or with the chemist, so they advise you if there was any interaction or not.
Thank you. And Dr. Ghuloum, you mentioned magnesium. Is there any specific kind of magnesium what would help with sleep? Because I know there are several different types available.
The thing is, magnesium is citrate. That is the one that's mostly associated with sleep, but also magnesium glycinate actually can help a lot with sleep. Just as a warning note, it can cause diarrhea for some people, but that's fine. It's nothing to worry about, just to be aware.
Okay, great. Thank you so much. I know we're a little bit beyond. Is it okay to answer just a couple more?
I don't mind. Yeah, of course.
Thank you so much. So again, just a question about, healthcare providers who may... Oh, sorry.
Speaking of stress, don't worry. I hope everyone is staying safe in a safe place. Don't worry.
Okay. So just...
one of the very... Sorry, I'm interrupting. Just reminded me one of the very healthy defense mechanisms actually is humor. I always say that to my trainees. So, there's nothing wrong with laughing things off, making a joke of it just to help you and help people around you calm down a little bit.
Yes. So thank you. So just a question about like healthcare providers experiencing stress during, these conditions. And, of course, we are also human beings as healthcare professionals. So it may impact the quality of care for our patients. So what advice would you have, anything particular for our healthcare providers, going through these situations? How do we handle some of this stress?
Yeah, I think it's the same to the general public who can hear the sounds now. It's the
Yeah.
same to the general. The difference with healthcare providers is that, again, remember that we're all working in the same place. We're all working in the same facility. We're all exposed to the same stress. So talking to each other, having that peer support is hugely,
Right.
hugely important. Yeah. Communicate with your colleagues, share experiences, share positive experiences, things that have helped you, listen to things that have helped them. Giving yourself break time. So if you feel that you are too stressed, it is starting to affect the quality of your patient care. Give yourself more frequent breaks. 5-minute break during clinical work can make a huge difference. It kind of recharges your batteries, it re-energizes you, and then go back. Yeah. So take a 5-minute break, go somewhere, go and chat with someone, go to a colleague, have a laugh with them, and then go back. Yeah. Talk to your supervisor because they might be able to help and they should be able to help you. Readjust your schedule for a short period of time until you are feeling better.
Sure. Just about the situation, because I know I've seen some of these posts on social media, and we have a question also. So again, the sound which is related to these alert messages, it's serving as a trigger for a lot of people, that it seems. So is there any way to sort of try and, how do we manage that trigger?
I mean, the sound is central. You can't even make it lower. And
Yes.
I read a paper a few days ago. Actually, someone had written on this and on the fact that the sound, the noise, the sound is making them more anxious rather than calmer. I think again, and remind yourself that the sound is there to help us, actually. It's to alert us. The sound is not there to tell us that you are now in imminent danger. The sound is there to tell you that now it's the time to go to a safe place. You have a reasonable time to go to a safe place. And we have a lot of advice from MOI on what to do when you're driving, what to do when you're in this place or that place, when you're at home. And these are all very useful advices. So when you hear the sound, just apply that advice and that's it. So again, do what is within your control. What's not in your control, you can't do much about it. So there's no point in worrying about it. And I know people would say, I can't help it, but you can help it. If you just remind yourself that this is what's within my control, this is what I'm going to do. So when I hear the sound, it's just a message for my sake that's telling me it's now time to practice safety. And I should listen to that advice.
Absolutely. And I think, Dr. Ghuloum, you alluded to the messages from the MOI on their website, on their they are excellent messaging is coming out. So I was so impressed. Yes, I was so impressed, so timely, and explaining in simple terms why they're doing, what the sounds mean. So I think the messaging is coming out really on point, and I'm really grateful also, for the messaging coming out and
I mean, personally, I found the messages about what to do when you're driving, because I drive to Said from home. And I found that very helpful, very reassuring. So, okay, I'm doing the right thing, or this is what I could be doing better when I hear the sound while I'm driving. So again, use the sound as this is an alert for our safety, for our well-being.
Yes, thank you. So I think we're going to end with a last question to you. And inshallah, on a positive note, we are in the last 10 days of Ramadan, the best nights, for us Muslims. And we are praying for everybody's safety, well-being. What would maybe a couple of takeaways from this session be for everybody to take away with them?
Stay calm as much as you can.
Yes.
Teach yourself to stay calm and don't say that it's out of my control. The more you tell yourself it's out of my control, you're imprinting that in your mind. You
Correct.
can control it. You can, again, do the things that are within your control, apply them, and you will be fine. And, you know, for the Muslims or non-Muslims, for Muslims, these are the best days of the year. These are the holiest days of the month. Pray. Pray for yourself. Pray for your safety, for everybody's safety. But prayer helps you relax and calm down. And the same with other faiths. And the same with non-believers even. Practice yoga, mindfulness, that kind of thing. So having spiritual approaches always helps.
Great. Thank you so much, Dr. Ghuloum. We are grateful to everybody who's joined us. We have about 500 people who've joined the session. A lot of thank you messages for you, you know, that it's been really, really timely and wonderful. So Alhamdulillah, you know, thank you for doing the session, and inshallah, we pray for, and inshallah, we come back in good times again also together. So thank you, everyone. Thank you.
Inshallah. Thank you all, and stay safe. Thank you.
Yes.
Assalamu rahmatullah.